Thank you so much, Dr. Dipang. Thank you. All right. Today we are going to. Hi, Kata. How are you? I'm going to do a very quick revision about drugs which are acting on the renin-angiotensin system. So some books write it as renin-angiotensin system (RAS), or some write it as RAAS. So that's जो another A है, that is for renin-angiotensin aldosterone system. ठीक है? सो अब इसको हम कहते क्यों है रेनिन एंजियोटेंसिन एल्डोस्टेरॉन सिस्टम? बिकॉज ऑल द थ्री कंपोनेंट्स दे आर कनेक्टेड, एक तरह से कनेक्टेड है वो. एंड अब हम आज करेंगे व्हाट आर दीज कनेक्शंस, व्हाट इज रेनिन, व्हाट इज एंजियोटेंसिन, व्हाट इज एल्डोस्टेरॉन, व्हाट हाउ डू दे फंक्शन, एंड देन वी टारगेट द ड्रग्स विच एक्ट ऑन देम. ठीक है? सो फर्स्ट, व्हाट इज रेनिन? एनीबडी कैन डू यू नो व्हाट इज रेनिन? किसी को? Where is it released from? English. Okay. English. I'll stick to English. Where is renin released from? Anybody? No? English? Yes. So renin is released from the JG cells of the kidney. Okay? So renin is released from the JG cells of the kidney, that is juxtaglomerular cells of the kidney. And the triggers, very good, Kata, it's kidney, and especially that's the JG cells that I said. Hindi and English. Okay, before I actually continue, please tell me the language I should speak on. Some are saying English, some Hindi. Either I use a mix of both, or because I'll go with the maximum then, right? So that maximum should benefit. Is Hindi okay? Or is English okay? Hi, Nikita. Hi, Megha. Hindi. Okay. I'll try actually both. Okay? So both. Yeah, let me try both. Okay. So let me tell you. And in case there is any issue, you can always ask me, DM me, and I'll explain it to you. Somebody has a problem understanding, right? So, because, okay, I'll keep on mixing both as much as I can. So, renin is released by the JG cells, juxtaglomerular cells of the kidney. And when is renin released? What are the triggers for the release of renin? Is when there is a decrease in the renal blood flow, or there is stimulation of the beta-1 receptors, which are also present on the JG cells, or there is a decrease in the sodium concentration. So the macula densa senses it, and there's release of renin. So that is one area, which is R. The A, what is angiotensin? Now, angiotensin, how is it formed? Angiotensin. Anybody knows how is angiotensin formed? What is the initial, how is it formed? From what entity is it formed? Angiotensin. It gets converted from what? So there are so many pharma students here. So definitely this is this should come naturally to you. So yes. Any idea? Kahan se? Where is it formed from? Angiotensin. It is formed from angiotensinogen converting enzyme. ऐसा कुछ नहीं होता. It is angiotensin converting enzyme. ठीक है? So angiotensinogen से बनता है angiotensin 1. Now, where is this angiotensinogen released from? It is released from the liver. So, from the liver, angiotensinogen is secreted by the liver, and with the help of renin, what does renin do? It converts angiotensinogen into angiotensin 1. That is the thing, right? So, angiotensin 1 is formed now. Now, the second step is conversion of angiotensin 1 into angiotensin 2, which is the most potent angiotensin. And that occurs with the help of the enzyme, angiotensin converting enzyme. It is converting 1 into 2. And this is released from the lungs. This is released from the lungs and converts angiotensin 1 into angiotensin 2, which is a most potent vasoconstrictor. Okay, so it will cause vasoconstriction, increase in the blood pressure, preload, afterload, everything. So that is the second component of RAS, which is angiotensin 2. Then the third component is aldosterone. So the aldosterone, it is released. Actually, the main trigger for aldosterone is your angiotensin 2. So angiotensin 2, it triggers and it releases on the adrenal attacks, and it causes release of this aldosterone. Or aldosterone, what it does, kya karta hai? It acts on the kidneys. The main role is for it to retain sodium and water. So this is the whole cycle. Okay? So renin, angiotensin, aldosterone system. So this forms a system. Now, whatever drugs we are going to they are going to act on this system, these are called the drugs acting on RAS. Now targets kya hai? Where can the drug target this particular system? So let's start right from the top. That is renin being released. Then it leads to conversion of angiotensinogen to angiotensin 1. Then angiotensin 1 being converted to angiotensin 2. Then angiotensin 2 causing the release of aldosterone, and aldosterone causing sodium and water retention. Now, the first target would be your, if let's say if beta 1 receptor are also the trigger whenever beta 1 is stimulated, because let's say there is sympathetic stimulation and beta 1 receptors are stimulated, they are going to cause the release of renin. So what if you give beta blockers? So they will cause the decrease in the release of renin. So beta blockers are one target. The second target is your, if you inhibit the renin itself. So renin won't be able to convert angiotensinogen into angiotensin 1. So you give renin inhibitors here. The third target is your conversion from angiotensin 1 to angiotensin 2. So there you give ACE inhibitors, because the enzyme that is ACE inhibitors, you give the enzyme, and therefore there you can block this conversion into angiotensin 2. Now, another target is when angiotensin 2 jo ban gaya, it is formed, how does it act actually? It acts by acting on its receptors. So there are two types of receptors, AT1, AT2. Yes? Nishma, it formed from the protein precursor angiotensin by sequential actions of enzymes. Yes, basically renin is responsible. Just remember that renin is responsible for conversion of angiotensinogen to angiotensin 1. That is. And then it converts to angiotensin 1 to 2 and then 3 and 4 and so on, and then it gets inactivated. So I was like AT1 receptor. AT1 is the most important actually receptor. And we have drugs which block the AT1 receptors. So they are called as angiotensin receptor blockers. I'll tell you how to remember the names of them. So then it's the AT1 receptor blockers. So you can block the action of angiotensin 2 on its receptor. So nothing is going to occur if it doesn't act on its receptors. Then the last target, you can do the aldosterone antagonists. So you can give aldosterone antagonists. So all these different drugs. So whenever there is a question on drugs acting on the renin-angiotensin system or renin-angiotensin aldosterone system, you can list all these and explain all of them. Whether it's your beta blockers, whether it's your renin inhibitors, whether it is your angiotensin ACE inhibitors, or it is your AT1 blockers, or it is your aldosterone receptor antagonists. So you can actually write all of this. Now, I'm going to actually specify or concentrate, because beta blockers, we do it in the autonomic nervous system and all. So let's start with basically the renin inhibitors. So renin inhibitors, only the thing that you should know is that, that they are going to inhibit the action of renin. So what will happen when renin is inhibited? They will not convert angiotensinogen to angiotensin 1. So that's one area. Aliskiren, enalkiren. So all of these are there. Captopril, we'll talk about this. These are the ACE inhibitors, Abhishek, right? So the kiren, jahan pe kiren is in the spelling, so you remember renin. Renin hai to kiren hai. So remember that. So these are the drugs which are your renin inhibitors. But the most important drugs to know in this, all of these, is your ACE inhibitors. Or these are the most important drugs to know. And jo ACE inhibitors hai, their names end with prils. Wherever the name is pril, that is your ACE inhibitor. So it's captopril, enalapril, lisinopril, ramipril, fosinopril, perindopril. So all the prils are your ACE inhibitors. Right? So important to know about these. Almost all of these drugs are prodrugs. So prodrugs means they have to get converted into its active form. But You do not know need to know कि कौन से convert होते, which all get converted, but exceptions are something you should know. All of them are prodrugs except captopril, lisinopril. These are the only two drugs which are not prodrugs. So only remember the exception, don't remember the general rule. Anytime, anywhere in pharmacology, wherever there is an exception, try to remember the exception, because general you already know that it exists for everything. So there are prodrugs except captopril and lisinopril. Please write it down. This is important. Some in MCQs this is asked. So captopril, lisinopril, they are not prodrugs. Another important thing to know. Captopril is the shortest acting. Captopril is the shortest acting. Perindopril is the longest acting. Another important point to know about. Captopril, shortest acting. Perindopril, longest acting. Now, because it is very short acting drug, the main problem with captopril is postural hypotension. Main problem is postural hypotension, seen only with captopril because it is short acting, not with the others. So these are the few important points to know about these individual drugs. Now I'll go to what are their uses. So what are their uses? So uses you can remember by a mnemonic which is called as DISH. D-I-S-H. DISH. So D-I-S-H, DISH. So let me see. Anybody, what does D stand for in DISH? If anybody has any idea, because many of you already are going through this pharmacology, already you're revising things. Any idea what D stands for in DISH? You can just write down. Even if it's wrong, it's okay. We are just learning here. We are not judging anybody. Even if it is wrong, you learn only. Just guess. Agar nahi pata, just guess. If you know, then write it down. What does D stand for in uses of ACE inhibitors? Or what is I? Those, no, it's the uses we are talking about. So D is like, where is it used? In which clinical condition are you using ACE inhibitors? Any idea? Okay, I, anybody has an idea? I stands for what? No, okay. S, H. H is a very common use, so everybody should know. H is something which is very, very common. You will see people prescribing this H. No? Alright. So please write down. D stands for diabetic neuropathy. D is for diabetic neuropathy. It's one of the important drugs which is used for diabetic, yes, diabetes. Very good. But it is diabetic neuropathy. H, very good, Abhishek. H is for hypertension, one of the primary drugs. So D stands for diabetic neuropathy. Very, very important drugs for diabetic neuropathy. I stands for infarction. You can say myocardial infarction. So remember, infarction, myocardial infarction. S stands for scleroderma crisis. It's actually an emergency where there is a hypertension and life-threatening hypertension hoti hai, renal failure and everything is there in this congestive heart failure. It's a crisis based. That's why it's called a crisis. S stands for scleroderma crisis and H stands for hypertension. One and second H is like heart failure. Hypertension, heart failure. So these are your four important uses. Very good, Dr. Deepa. Very good, right? Hypertension. Yes, absolutely. It's one of the one of the drugs, primary drugs, which is used for hypertension. So D is for diabetic neuropathy. I is for myocardial infarction. Infarction I ka. S is for scleroderma crisis. H stands for hypertension and heart failure. One of the most important drugs for these. So these are the uses of ACE inhibitors. That is important. Then we can talk about what are the adverse. One is important, it uses. Even the adverse effects of ACE inhibitors are very, very important to know. So I'll give you another mnemonic to remember the adverse effects of ACE inhibitors. Angiotensin. If you remember the spelling, ANGIOTENSIN. Angiotensin. Okay? So if you remember this spelling, you can remember the adverse effects of angiotensin inhibitors. ACE inhibitors. So AN in angiotensin. AN will stand for angioedema. The side effect, we are talking about the adverse effects. AN stands for angioedema. Then G stands for granulocytopenia. G stands for ACE inhibitor. ACE is an enzyme. ACE inhibitors are the drugs which inhibit the ACE. Okay? So yes, I'm coming to dry cough also, Abhishek. It will be covered when we just do the mnemonic, and it will be easy for you to then be. Dry cough is, yes, very important side effect with the ACE inhibitors. So G stands for granulocytopenia. I stands for increase in the potassium levels, or you can say hyperkalemia. But just to fit it in the mnemonic, I stands for increased potassium levels. So it's one of the drugs which can lead to hyperkalemia, increased potassium levels in the body. O stands for orthostatic hypotension, I told you before, but it is only because of captopril. That's the only ACE inhibitor which causes this. So O stands for orthostatic hypotension. Then TE stands for teratogenicity. So it's a teratogenic drug. So it is absolutely contraindicated in pregnancy. Okay, that is TE. N stands for no taste. No taste matlab, and the other name. So whenever patient is taking, the patient has, the loss of taste sensation, no taste. And the other name for medical term kya hai no taste ka? Dysgeusia, or Dysguesia. That is no taste or altered taste. So N stands for no taste. That is one other side effect. S stands for skin rashes. S stands for skin rashes, and last may I N together stand for increase in the cough, or the dry cough especially. Increase in the dry cough. So these are the adverse effects of angiotensin converting enzyme inhibitors or ACE inhibitors. I'll repeat again. Angiotensin ka spelling you remember, and then AN stands for angioedema, G stands for granulocytopenia, I stands for increase in the potassium levels, O stands for orthostatic hypertension, but it is important to put in brackets only with captopril, not with the other ACE inhibitors. TE stands for teratogenicity, N stands for no taste, S stands for skin rashes, and IN stands for increase in the dry cough, or increase in the cough. And the reason for increase in the dry cough is dash. What is the reason for the increase in the dry cough? A very important MCQ question. The reason for increase in the dry cough is because of, yes, loss of taste is, yes, I said no taste. That is dysgeusia. That is definitely correct. I'm asking, what is the reason for the dry cough? What is the reason that people have dry cough when they take ACE inhibitors? What is increased in the body which leads to dry cough? Granulocytopenia. These are the blood cells, Granulocytopenia, decreased. Loss of fluid, no. Increased cough is because of bradykinin. No. Increased potassium is hyperkalemia. But dry cough ka the reason is that is bradykinin levels are increased. Because actually what happens, jo ACE enzyme hota hai, ACE wala enzyme, it also, what it does, it helps, it is important for the metabolism of the bradykinin into its metabolites. So when you give ACE inhibitors, bradykinin doesn't get metabolized, and it increases in the body, the level increases in the body, and it causes dry cough. So that's one of the main reasons for dry cough. Also, what bradykinin does is it also leads to vasodilatation. That is another effect. So bradykinin is responsible for two things. One is dry cough, even angioedema. These two things are because of bradykinin. So just remember, these are very, very important. Adverse effects of ACE inhibitors are very important to know. And the dry cough is one of the most common side effects. Because of that, many people, when they start on ACE inhibitors, many people, when they start on ACE inhibitors, you have to put them away. They cannot tolerate that kind of dry cough. They cannot tolerate dry cough, and you have to take away from them. Then you have to put them on the angiotensin receptor blockers. Dosage form, beta. They are in oral tablet form में available है ये. They are available there. Okay, so this was about the ACE inhibitors. So ACE inhibitors हमने कर लिया. So this is important. The second one is the angiotensin receptor blockers. So इसके नाम में पता लग रहा है these are the drugs which block the angiotensin receptors. Now what are the names of these angiotensin receptor blockers? We have losartan, valsartan, irbesartan, candesartan, telmisartan. So all of these drugs will have sartan in the end. ACE inhibitors have pril in the end. All of them have sartan in the end. ठीक है, sartan. So अगर confusion sometimes you have कि whether sometimes you get confused, sartan is ACE inhibitor or sartan is angiotensin receptor blocker. What is it? So remember one thing, that is SAR, जो last में SARTAN, sartan है ना. So उसका आर्टन याद करो, ART angiotensin receptor और AN is antagonist. So ART antagonist, angiotensin receptor antagonist. तो इसके जो suffix है इसका sartan, that stands for ART antagonist. You can remember it that way. So you know that this is an angiotensin receptor blocker and not an ACE inhibitor. So these are your sartans and they are your AT1 blockers. Now they actually block the AT1, so that is almost the actions are similar to that of ACE inhibitors. But because they don't inhibit the ACE enzyme, so क्या होगा? They don't have any effect on the bradykinin. So the dry cough which is seen with the ACE inhibitors is not a problem with these drugs. So any patient who has a problem with ACE inhibitors, like he or she cannot tolerate that dry cough, so we can shift that patient to angiotensin receptor blockers. So what they do is they will not allow the angiotensin 2 to act on its receptor, so the actions would be the same. The only thing is the way is different by which they act. So they are going to block the receptors. Okay? So telmisartan in this is the longest acting ART, angiotensin receptor blocker. It's the longest acting among this. So what else is important here? So almost similar, and remember the difference basically is in the dry cough. The dry cough seen with ACE inhibitor, not seen with this particular drug. Otherwise almost everything is the same. Then the last one in this, the drugs is your aldosterone receptor antagonism, which is seen with drugs like spironolactone and eplerenone. So both of them are aldosterone receptor antagonist. So what is the role of aldosterone? Basically, it enhances the sodium and water retention. And in exchange, because it retains sodium, in exchange, it will, what will it do? It will throw out the potassium from the body. So when you give aldosterone receptor antagonist, what it does is it blocks the effect of aldosterone. So this potassium is retained in the body, right? So these drugs can also lead to hyperkalemia. So spironolactone, eplerenone, ठीक है, ये दो drugs हैं. So spironolactone के बारे में what you need to remember it gets converted into its active metabolite, which is called as canrenone. That's important. Canrenone is an important active metabolite of spironolactone. And the main problem or side effect with spironolactone, because of which it is not much preferred, is gynecomastia. That is one important side effect of spironolactone, not seen with eplerenone, right? So, and what, how it is beneficial, because it is also, aldosterone is one entity which has been linked with causing ventricular remodeling, especially in CHF patients. So it causes the ventricle remodeling. Ventricle remodeling is ventricular hypertrophy, and it spoils the effect of the functions of the ventricles. So any drug which inhibits the aldosterone, it will actually have a good effect on or it will prevent the ventricular remodeling. So it has also that kind of beneficial effect. So all of these drugs are your drugs which act on the renin-angiotensin system. So just telling you again how, in order you remember, it's easy. You can have beta-1 blockers, then you can have renin inhibitors, then you have ACE inhibitors, then you have angiotensin receptor 1 blockers, and the last one is your aldosterone antagonists, right? So that is this one. 81 blocker, Abhishek, I don't understand. What is 81 blocker? You want beta blocker? All those LOLs are beta blocker. Okay? So all those beta blockers, you can, because that you can use, right? All right. So I hope that you could make out now. This is an important question, which is, these are, in message, a lot of MCQs are asked, and even for university examinations, this question is very common. Drugs acting on the renin-angiotensin system. So please remember the names of the drugs. That is important. Remember the exceptions when I talked about in this ACE inhibitors, which are not the prodrugs. Remember their adverse effects by the mnemonic of angiotensin. Remember the uses by DISH, D-I-S-H. Okay? And aliskiren is a renin inhibitor. Renin is important for conversion of angiotensinogen into angiotensin 1. So if you block the renin, that active site on renin is blocked, so the angiotensin cannot, get converted into angiotensin 1. So that is the main role of aliskiren. So it is, iske naam mein ye na REN. So remember, renin inhibitor. Okay? So that is how they will act. Right, Karunika? And anybody who's missed the initial part of this, when I post this, just go through. I already mentioned how these drugs are going to act, so it will make more sense then. And what actually I find that many of you ask for mnemonics, right? So mnemonics for ACE inhibitors is it'll be very, very helpful, especially the DISH and the angiotensin. You don't have to remember angiotensin ke liye something else. So remember the spelling of angiotensin, and you're going to make out all the adverse effects, which again I repeat are very important, and the difference between AT1 blockers and angiotensin inhibitors. The dry cough portion, that is the reason why most of the physicians or the doctors, they change over because of the problem of dry cough with ACE inhibitors. So I hope this session made sense, or you could gather some important points about whatever I wanted to tell you, because in this brief revision, it's only for actually, revising, and many of you have already done this. You could just briefly in your mind revise these topics, and whoever have not actually started reading the chapter, so go through this Insta Live and then go back to the chapter and study in your books, right? Thank you so much, Ryan. So go back and study, and then this will start making more sense. Karunika, thank you, Karunika. Thank you, Ryan. So that is one thing, right? And what I suggest is, whenever you're watching videos or courses, make sure that that helps you or that enhances your grasp of the subject, but always refer to it. There should be a standard textbook always with you, right? And I have a group, Simply Pharmacology. It's a free group. So anybody who would like to join that group and interact in that group and ask questions and get questions answered there, thank you, Ansh. So you can always do that, right? Okay, anybody who would like to solve? Abhishek has some question. So it's open to this after IV administration, right? Thank you, Abhishek. Okay. So, I got it. It just went away, actually, the question, right? I'll explain that, okay? Okay, so anything, you can join. Thank you so much. All right, Nishima. So glad that it could help you. It's a quick revision sessions. And yes, any topic which you would want me to, which can be covered in, 15-20 minutes, you can always DM me and I'll do that. And Abhishek, you can connect with me, and any issues you have, I will solve them. If you have any problems in general pharma or anything, I will help you. No problem in that. So see you in the next session of Insta Live, and do go through this, and any doubts you have, I'm always there. Yes, beta, Ansh. I'm always there on Insta. You can DM me and ask me questions, or you can join the Simply Pharma where I'm more accessible, and so we can actually just help out each other and do the best that we can. All right? Okay. Thank you so much now. So all the best. Study hard, study well, and God bless.